Hello, everyone, and welcome to Mind Your Mental, a podcast that seeks to educate, empower, and uplift those seeking guidance through the monumental world of mental health. I'm your host, Raquel Martin, a PhD candidate in medical and clinical psychology. This podcast is not meant to be a substitute for a relationship with a licensed mental health clinician. Thank you so much for tuning into the show, and I hope you enjoy it. Hello, everyone, and welcome to Mind Your Mental. Today, we have an awesome guest, Dr. Scatino. So we are going to be talking about all things mental health, and this episode is more going to be like an expertise talk because Dr. Scatino is a licensed clinical psychologist. He got his BA from Princeton. He got his PhD in clinical psychology from UCLA, and he got that on his own accord. None of his parents had to pay for that, so that's amazing. He also has international psych experience as well, like working in Berlin. So we're going to be talking more today about like agoraphobia and social anxiety. If you haven't heard that word before, you will know all about it after this podcast. It's pretty cool. So without further ado, Dr. Scatino, did you want to, Dr. Jonathan Scatino, I'm sorry.
That's all right. It's okay. You just call me Jonathan if you want.
Okay, Jonathan.
Well, I'm happy to be here.
You want to tell us a little bit more about yourself? Thank you so much.
Sure. You kind of hit the high points there. But yes, I got my BA from Princeton. Then I went on to UCLA to get my PhD, and I did a postdoc in Germany. And a postdoc is really just, I like to think of it as an extra year of sort of cheap labor for the field of psychology. But it is also a year where we can specialize and learn a little bit more about, a particular presenting problem or a particular type of population to work with, or even a particular type of therapy. So it is a useful year to specialize and learn a little bit more about your craft before you go on for the license in clinical psychology.
Yeah, I think of it more as free labor too. Like, I like the way you put it as more specialization, but it's also free labor because we make nothing. So what did you specialize in on your postdoc?
That last part was the party line, Raquel.
Yeah, it's like we make.
I was like, I had to say that. My check's in the mail. What was the question that you had?
What did you specialize in on your postdoc?
So on my postdoc, I was big into psychological assessment while I was in my PhD program. And for the listeners at home, when you're in a program, you can kind of specialize. There's two sort of branches. You can specialize in therapy, or you can specialize in psych testing and clinical assessment. That's basically like personality testing. It could be forensic assessment. It could even be neuropsychological assessment. If somebody is coming to your clinic with memory problems or attention problems, you can do psych testing to figure out what's actually causing those problems. So my postdoc was more in personality assessment, where we use psychological testing tools, kind of like personality tests that you might see on the internet, but like much more advanced and a lot more research behind them. Also a lot longer typically. And we use those tests to help us with diagnostics, help us to better understand an individual without, having to observe them, just living their lives for years. We can kind of get a lot more information pretty quickly just by reviewing the test results. So that's sort of in a nutshell what personality assessment is and what my postdoc specialization was in.
Oh, that's really cool. So like I'm doing more clinical right now. I'm probably going to have like my career be something when it comes to psychological assessment, because working at Hopkins and seeing everything, I can definitely tell that it's not done accurately with everyone, like from the cultural competence perspective. So like it's definitely something that I'll pursue, but I've been doing more clinical work lately. So I guess my first question is just to start off, just because, as a Black male, what made you decide to pursue a career in mental health? I always call Black male psychologists unicorns because there are none. So what made you, like, for real, like, right. It's like, got one. What made you to decide to pursue mental health? Because it's just not a typical, I don't think it's a typical field anyway, but especially for men, especially for Black men. Like, what made you decide this was what you wanted to do?
That's a deep question. And when I look at my role in mental health, I have to go back and think about Well, I kind of see myself as what we call in the field a scientist practitioner. Um, and what I've always been interested in, going way back, and this is going back before I can even remember. Um,
Well, before you even get into that, you have to just you have to say what scientist practitioner is. You can just
okay, right. I'm a unicorn. I'm not used to being on podcasts. You caught me today, and I'm, you know. Um, so a scientist practitioner is really this idea that in psychology there are practitioners, so people who work with individuals on emotional problems, behavioral problems, anything that someone might come into therapy for, relationship problems. So there's the practitioner piece, and then there's the scientist piece, and the scientist piece is really just using psychological science to help inform treatment. So just like when you go to the medical doctor, and you're hoping that they're not just practicing um, you know what they feel like doing that day, they're actually consulting the science to be sure that when they're examining you, that they're using sort of the latest methods to do that. um, Therapy is the same, at least from a scientist practitioner standpoint, that therapy should also be informed by the latest science, or at least evidence-based practice. And that's what a scientist practitioner is. Um,
okay, so you just make sure you're not just talking about stuff. Like
yeah,
there's evidence behind it. Like this
exactly.
is well researched. This is what works for your diagnosis or your age range or your culture or whatever. This is what's going to help you because it's well evidenced. And if not, like there are other methods that we can look into as well.
Exactly. And I'm not going to say that talking doesn't help. It certainly does. And the science shows that. It's just that, if we're going to be treating a particular type of issue, like if someone comes in with agoraphobia, we want to make sure that, looking at the science on how to treat that individual, and what the science has shown has been effective to helping overcome that particular difficulty.
Yeah, because there's so there are a bunch of different styles or therapeutic orientations and stuff like that. When it comes to therapy, you've got like cognitive behavioral therapy, which is one of my favorites.
Mm-hmm.
You have like acceptance and commitment therapy. You have all these different kinds, but these are all well researched. Like one of the ways I always tell people like why talking to me is different than talking to your friend is because one, I'm trained, been
Right.
doing this for a while, and also like we're trained in this because talking isn't just that's like when we do talk therapy, it's not just talk therapy. Like we're guiding you to answer certain questions. You have to delve into like certain aspects. Even just talking isn't just talking. Like when we're talking about I don't know, thought restructuring or challenging your thoughts. That's different than just talking. That's actually work. You
Right.
know, like there's a difference between like venting to a friend, and then adding the catharsis aspect and adding the treatment aspect and the maintenance of your goals. Like you don't just vent to a clinician, because
Right.
you can do that with anyone. You're talking to someone who's trained to actually work with you on the issue. Like if you want to vent, go talk to your friends. I'm
Right.
cool with that. But like therapy is work. So like in order to make sure it does work, we kind of have to like not only just listen to you, we got to ask the right questions. We got to see where this is going. We got to have like a conceptualization of where we think your symptoms are coming from. Because if we're working on one thing and then the symptoms come from something else, we got to figure out how to like reroute it. So it's I always tell people like it's more than just therapy. I mean, it's more than just talking because like what you can talk to anyone, and then that's us wasting each other's time.
Right.
We
Exactly.
all these trainings, man. We've been in school forever. Okay,
Yes.
like it's
Hmm.
it wouldn't take forever to get a PhD, PsyD, whatever if you just talk to people. That's like a year
Yeah.
training, maybe.
Maybe.
That could be a webinar. That could be a webinar. Like you wouldn't need
That's
to
an
go
in
to
service right there.
right there. But yes, okay. So before I interrupted you, you were talking about why you decided to get into the field.
Yeah. So let me tell you about science. So, um, going way back, I've always had an interest in science. And even as a kid, the toys that I played with, like the ones I got most excited about, were like the nerdy science toys. Like I had the ant farm. I had the chemistry set. I had the telescope that really couldn't see anything. But I still had it. You I collected rocks. I'm a huge nerd, and have always been interested in science and understanding the world around me. But sometime in high school, at least by high school, that interest in science that was more broad narrowed into an interest in psychological science. And there was something that was appealing to me about using the science of psychology to understand, what drives people, what motivates people, you know, what are people's strengths and weaknesses cognitively and emotionally, in terms of how they think cognitively and how they feel emotionally. And using that information to solve problems, which I'm big on, and help people. And it just seemed like the field of psychology, and particularly practicing psychology, was a nice fit for me in terms of my interests and skills. And then I found out later that it also is a great fit for me values wise. And I've heard you talk about on the podcast, Raquel, that values are important. And for me, one of my values is being my own boss. Another value of mine is having a little variety in the work that I do. Yesterday I was working with patients. Today I'm on a podcast. So there's a lot of benefits for me in this field, and that's what drove me towards it.
Yeah, I get that. I say shout out to all the nerds because my favorite toys growing up were puzzles and books.
Mm-hmm.
Every Sunday, my mom took us to the library. It was the like after church, of course. God, and so like after church,
Right.
and like we have church. Then we get fried chicken from this fried chicken place, and then we go to the library.
That's my
and it
my
was
kind of Sunday right there.
right? Then you go home, you have your after church nap, you get ready for school, you good.
Mm-hmm.
But like everyone, you have to be some aspect of a nerd because to be honest, like so I'm on my pre-doctoral internship, just in my dissertation, like I'm doing a postdoc in September. But you have to you gotta be a bit of a nerd. You gotta want to have like a value of like academic excellence because you're gonna be doing this for a while. And then even after you get like after I get my after I finish this internship and then I graduate anyway because dissertation's done, then I do my postdoc, then I do licensure, and then we have continuing education. We still have to do stuff. It's not like you just get your degree and it's like, oh, you cool, you don't have to read up on nothing else. No, like we still have to do it. So yeah, I think being my own boss is a value that like I never thought I would do private practice, but I think I am leaning more towards that because it just seems like I just want more room to just be able to be like, you know what, I don't want to schedule patients this day, so I'm not going to, and I'm going to go to the park. Like,
join us. I'll preach that gospel all day long.
Like I'm just not, you know what, I'm not feeling it, so we're just not going to see people today. So that's pretty cool. And yeah, you're right, because like values align with everything. I think living a value-driven life really can help with some of the complications that individuals have with choices. Like if a choice doesn't align with your value, don't do it. And then if you do it anyway, you're going to have some kind of like upset. So just be ready for it because it's going to come. Like,
you're going to pay for that some way or another, right?
You're going to pay for it. So just know that going in. I hope you enjoyed it. But you work with a lot of different patients in the first place, but I really wanted to talk about like agoraphobia and social anxiety because I actually feel like it's something that a lot of people don't really get that much experience with, especially agoraphobia. So can you talk a little bit about, about that? Like one, do you see a lot of individuals with that, or like what is it? Like start off wherever you want.
Sure. Well, let me zoom out for a second actually. So agoraphobia is one of the disorders that we classify under the general or broad category of anxiety disorders. So if you look at the DSM-5, which is basically our Bible for diagnosing mental illness, there's a category called anxiety disorders. And basically what anxiety disorders are is any mental health condition where excessive fear, anxiety, or worry is the central focus of that condition. And that excessive fear, anxiety, or worry causes either marked or significant distress or dysfunction in the individual's life. So, they're not able to do the things that they normally do or need to do because of that anxiety, worry, or fear. And they're feeling such a severe amount of that anxiety, worry, or fear that when it does come, it feels almost painful, for them. And that level of intensity can make it difficult for them to function. So just to start there with anxiety disorders and what they're about. Now, the thing that differentiates anxiety disorders from each other is the focal point of that fear. Okay, so for agoraphobia, the focal point is really on fear of usually a life-threatening event happening to that individual, and that individual, A, not being able to escape when that life-threatening event may happen, okay? Or B, no one discovering or finding out about that, that individual when the life-threatening event happens. So in other words, they won't be saved if that thing happens. So when I say life-threatening event, what do I mean? Basically, it could be anything from a panic attack, which is actually not life-threatening. Okay, I can talk more about that later if you like. To a heart attack, which certainly can be life-threatening. To someone going crazy and losing their mind. Someone being abducted or assaulted. It could really be anything that the individual perceives as something that could be life-threatening or dangerous.
So yeah, so it's a manifestation like of the anxiety. So when you say this fear, like I always like to focus on physiological symptoms, because a lot of times individuals aren't tuned into like themselves emotionally, but they can check into where their like heart's racing or they're sweating and stuff like that. So what would you say are the physiological symptoms most of the time attributed to this kind of anxiety? Like if someone is having an episode connected to agoraphobia.
Yeah, so basically the physiological or physical signs of anxiety, they mimic the fight or flight response that the body has. Okay, so when you get scared, or when someone sort of, let's say you're driving down the highway and someone suddenly swerves into your lane, you get that sudden shock of adrenaline. Some of the physiological symptoms that go along with that are the same ones that go along with anxiety, particularly with agoraphobia. So things that we might see or very often see are an increase in heart rate, shallow breathing or increase in the rate of breathing. We might see sort of like clammy or sweaty hands, trembling. We might also see the dilation of the pupils, which is something that a lot of people don't think about. Flushing of the skin can also happen for people who are more fair-skinned. So there are a variety of different signs that would indicate that this fight or flight response is happening.
Okay. So, and I think that's something that most people can tune into, right? Like most people know how they are when they are experiencing that fight or flight, like when you're experiencing stress. Cause I think typically your body has its go-to thing. Like some people just get flushed. And with me, it's not even like, I don't think you can see that I'm flushed, but I get like this wave of heat over my body and no one has turned on the heater, or like you may start shaking. Like I feel like sometimes I'll get like not tunnel vision, but like with my ears, it seems like things like kind of tune out. Like it's like the sound has kind of like dimmed from the room, and I'm like focused on something else. So like everyone's body has like a different symptom, and I always say focus on this. Always, let your provider know about the physical symptoms too, because when patients tell me about the physical symptoms, it actually helps me decide what kind of coping skill might be helpful for them. Right. So if you are like breathing incredibly heavily and you're losing your breath, then like breathing exercises is something that can help you significantly. If you feel like your thoughts just start racing and you can't focus, mindfulness is something that can help you significantly. If you feel like you start like tensing up, then we'll work on like progressive muscle relaxation. Like there's so many things that go into treatment that you have to know all the information, because like if there's a physical symptom, there's a coping skill to go with it. So I always tell everyone, like when you're talking to your clinicians and we're talking to everyone, tell them all of the symptoms, because it will really help them come up with a treatment that's best for what's happening with you. Like everything like links in, but if we don't know, we can't help.
Absolutely.
Like, it's not possible.
Yeah, and when I work with patients, I always say, you know what, I may be the expert on this type of therapy, but you're the expert on you, and if you don't tell me what your experience is like, I'm not going to be as helpful as I could be.
Yeah, and then you're going to say I did a bad job, and you're going to stop coming.
Right.
And you're going to be like, that didn't help. Yeah, well, I didn't know that you were passing out every day. You didn't tell me that.
Exactly, And here's the funny thing about this, Raquel. Like when people go to the medical doctor, imagine that they went to the medical doctor and they didn't tell them about any of their symptoms. What do you think would happen there? If somebody's, they were having, the flu and they didn't tell their doctor about any of the symptoms. They didn't tell them about the cough. They didn't tell them about, nausea. They didn't tell them about the fatigue, and they just told them everything was fine. What do you think the doctor is going to say?
He's gonna say you're tripping, but thanks for the copay.
Yeah, thanks for the copay. I'll take your money any day, but see you later. Come back in 6 months, So it really is about that crosstalk, that collaboration that's important, between the professional and the patient.
Yes, and like I get that like you may not feel that comfortable in the first place, so like it takes a while to warm up, but like we don't get the information unless you tell us. So like we have to know. And that's why if you have a clinician that you're not comfortable with, then it's necessary to either approach it. And if you don't feel comfortable doing that, find another clinician because they're not going to help you. So you can't just say, oh, they just weren't helpful. Well, you had one session. That's like an intake. I don't even know how amazing I'm going to be in the first session at solving all your problems. And second of all, you didn't tell them anything.
Right.
Like you have to be open with the process. Like you have to understand it takes work. You also have to share and you have to build comfort. And then also let your psychologist or therapist or counselor know, like, I am actually not really comfortable right now. And the first thing they'll say is, okay, how can I help you with that?
Right.
That's it.
Yeah.
Like, they're not going to say, get out. My style is amazing. How dare you, sir? Like, they're not going to say that. They're going to say, what can I do to help?
Yeah.
Like, what do you need? Because it's your time and it's your session. So like, just be more open. I always preach therapy to everybody, of course, ridiculously biased, but it's also because it works. But when I'm saying it, I'm like, give them more than one session, please. Actually say what's going on. This is someone who's confidential. So like, unless you were talking about danger to self or danger to others and stuff like that, you can share with them whatever. Like, it's just be open up so that we can help. Like, it's necessary. And especially with agoraphobia, when you're experiencing such intense anxiety, like, it's not comfortable. There's no way this is comfortable. Like, help me to help you. I need to we got to figure out what's going on with the anxiety that you're experiencing and the fear that you're experiencing. Because as a result of this, you're probably avoiding places, avoiding situations. You feel like trapped. You feel helpless. You feel embarrassed. Like there's so much going on, and I can only imagine it's not a pleasant place to be.
Absolutely. And when people come to see me, by the time they get to see me, there's been a lot of avoidance. And I like that you brought that word up, because avoidance is something that we do when we're anxious. In fact, the emotion of anxiety, one of the major motivational forces behind that is to get us to avoid or escape something, right? And if our anxiety is getting us to avoid things that are important to us, like going to work, spending time with people that are important to us, going to school, if we're avoiding these things because we're so anxious around them, that's going to have a major impact on our lives. And, not just in terms of the things that we have to do, but the things that we value sometimes too.
Which is going to add another symptom of possible depression on there.
Right. Right.
It's like you're not spending time or doing what you want to do. You're withdrawing, and it's just like, it's intense. So like with that, how would you differentiate agoraphobia from social anxiety? Because they're two entirely different things. Like, they're both under the category of anxiety disorders, right? But like you mentioned before, in the big book of diagnoses, it's more so according to what is manifesting, like what the anxiety is towards. Like, specific phobias is a type of anxiety disorder, but it's because of specific things. Like, each phobia has a different thing. Like, of course, everyone knows arachnophobia is being afraid of spiders, and you also have fear of needles and stuff like that. Like, it's all dependent on what you're afraid of. So like social anxiety is clearly a fear of social situations.
Yeah. So it's a fear of social situations, and it's also in those social situations a fear of being negatively judged. Right?
Yeah, I think that's the biggest part.
That is the biggest part. In fact, that's one of the diagnostic criteria. It's one of the things that you have to get that particular diagnosis, is that when you're in these social situations, that there is a fear or a thought that you're going to be negatively judged by other people. Now, the social situations themselves may vary. I've worked with people who, there's sort of the classic, fear of public speaking, right? Fear of sort of being up in front of people and presenting. And that's so excessive that they're not able to do their job or study effectively in school. But there's also sort of more obscure types of social anxiety, and that could be anything from just having a conversation with a stranger, being in a group and talking, even eating in front of other people or writing in front of other people could potentially be social anxiety, as long as that fear of negative judgment is there.
Well, so how would you say you typically, like, say you're doing an assessment, or you're like meeting a new patient and you kind of think like one of these disorders might be prevalent. An assessment is everything. And I know you, like a lot of people do, like, fill out pen and paper assessments, but what kind of questions do you ask people to kind of get a good case conceptualization, like to start with? Like, what are the things, the questions you ask to see, like, is what I'm thinking it's social anxiety. Is it this? I'm thinking it's agoraphobia. It's this. Like, what do you ask?
Yeah, so I'm always asking about. I'm a cognitive behavioral therapist, and I don't know how much you've talked about CBT on the
Not much. Yeah,
podcast.
I haven't delved in. It's the aspect of understanding that thoughts connect to feelings, connect to behaviors. So you're kind of trying to change one or the other, just to make sure that you're able to improve. So negative thoughts lead to negative behaviors. Positive thoughts lead to positive behaviors. So if you are having like a situation where you kind of, and this is like very simple. If you
That's
have a simple, I always give the example of to my patients because I work with kids. Like if you
okay.
walk past a group of people and they started laughing when you walked past and you
I
thought they were
love
laughing at you, how would you feel? And you were like, oh, I would feel bad and I would feel embarrassed because they're laughing at me, right? So I'm like, okay, so say you walk past that same group of people and they start laughing and you notice everyone's looking at a screen. They're like watching a TV show. What would you think? And I was like, they're always like, I probably wouldn't think anything. I'd probably want to see what the TV show is. It would be like, what would your mood be? Oh, it'd be the same, right? So it's the same situation. It's just your thoughts are different, right? Like it's your thinking changes how you feel. And as a result, like you might have a different behavior. If you think they're laughing at you, you might run away and feel sad. If you think they're laughing at something else, you might actually engage with them and try to see what they're laughing at. But it's the same situation. It's the same scenario. So with CBT, you're really just trying to we do a lot of like functional analysis and behavior. Like we really break down what is the guiding thing that guided your behavior. Like, were you feeling a certain way? Were you thinking a certain way? How do we challenge that and change it
Yeah,
as a simple way? But yeah,
that's
if
exactly
we're
right.
just gonna break it down really quickly.
Yeah, I mean, I could tell you've done this before. So, yes, that's exactly what it is. And in light of that, what we're trying to do is we're trying to get a sense. Well, when I'm doing an interview, an initial session, I'm trying to get a sense of what the thoughts are. How are they thinking about or interpreting these situations that you described? Because that's going to give me a better understanding of what's going on diagnostically. Because as you just said a moment ago, it could be the same exact situation, but there's so much more information that's gained by how the individual interprets that
You
situation.
actually you cut out for a little bit. You want to restart that part?
Yeah, let me kind of backtrack a little bit. So you can have the same exact situation, but how the individual interprets that situation is going to have a huge impact on how they feel and ultimately what they do, right? To use the laughing example, if I walk down the hall, if I tell a patient, if you walk down the hall and people are laughing, what do you think? They might say, oh, I think they're laughing at me, but is it necessary that they're laughing at you? What else could they be doing, right? They could be just laughing at a joke that they told, right? Maybe they saw something on their phone, they're on Instagram and there's something that was funny. So it really depends on how we interpret events in determining how we feel more than the events themselves. And that's a big part of CBT. So I'm going to ask questions about not only the triggering situations where they feel anxiety or they have agoraphobia, but how do they think about those situations? So that's going to be one part of my questioning, one part of my conceptualization of this person's difficulties or concerns. The second part is getting into the feelings themselves. Okay, so when they get on public transportation, let's say they get on a train or a bus, and for people with agoraphobia, particularly the type where there's a lot of fear around not being able to escape, that can be very threatening for them, being on a bus or being on a train where they can't just get out if they need to get out. So I'm going to be asking them about how that makes them feel. What are the physical sensations? We talked about that a moment ago. What are the physical sensations that go along with that? And also, what are the behaviors? And when I talk about behaviors, I'm talking about choices that people make. A lot of people think behavior just means anything that we do or any action that we take. Well, when you're talking to a cognitive behavioral psychologist, a behavior is anything that we choose to do or not do in response to our thoughts and feelings. So there's choice, okay? And that's what makes a behavior something that we can modify, because it's something that is under your control. It's a choice, right? So what are you choosing to do in response to your thoughts, how you're thinking about it or interpreting a situation, and your feelings, how you feel when you're in that situation. And the biggest behavior that I'm looking for is avoidance. It's the things that you're not doing, right? It's the places you're not going because you're anxious or you have negative thoughts about what will happen to you when you're there. It's the people you're not talking to because you're concerned about what they may do to you or think about you. It's the situations that you're not getting in that's more important than the things that you're doing. So I'm going to be asking a lot of questions around behavior, but getting to think about, well, how has your life changed since you've noticed that anxiety's become such a big part of your life? What are you not doing that maybe you did 5 years ago, 10 years ago, even 6 months ago before you noticed this was a problem? And kind of taking the discussion from there.
Yeah, I think the changing aspect is something that I always focus on. And this is something that like all you listeners can and think about when you're thinking about any kind of thing that may be impacting your mental health. What has changed? Like, has anything changed? Have you stopped going out? Have you stopped enjoying something? Have you avoided a situation completely? Have you added an extra hour on your commute because instead of like taking the bus, which scares the crap out of you lately, now you're just like walking the extra couple of miles to like think about what is the deviation from your norm, because
Right.
that's really going to help give information about what is happening with you. Because if everything was the same, then you probably wouldn't be coming to see me, to be honest, or unless everything
Right.
that was the same is awful. But like most of the time, something has changed,
Right.
right? So it's just like, what has changed? Like, what is different? Like, oh, I don't sleep as much. Oh, I'm exhausted. Oh, I don't enjoy anything. Oh, I'm freaked out of my mind. I don't know when it started, but I know it hasn't stopped. Like, I
Right.
just need some some help with this. Like, that's something before you decide to go see a therapist. Like a lot of times it's like, what kind of questions do you ask yourself? Just because some people, this is not meant to be a replacement for a relationship with a licensed mental health professional, duh.
Right.
But it's also the fact that you decide to come in. You're the one who decides when you're sick enough to come in, right? When you go to the doctor to get the flu, you get like the body aches and the chills, and you're like, all right, now this is getting crazy. Like, I think I actually do
Mhm.
need to get something. The same thing happens before you decide to see a mental health professional. You have to decide what has changed, and if your well-being has been impacted enough to go see someone. And the best way to do that is kind of ask yourself these questions, like, are you avoiding something? Are you experiencing new symptoms? Has something changed that you don't like, that you kind of want to work on? Those are the first questions to ask yourself. And if the answer is yes, 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 definitely, like go on like
Yeah.
Psychology Today, therapy for Black men, therapy for Black girls, Google, look on your insurance card, like just do a walk-in. That's when you need to go talk to someone.
Absolutely. Because a lot of this stuff is not common knowledge. We've trained for years to learn this information, to learn what the questions are that need to be asked, to help people with anxiety, with depression, and with the particular types of anxiety disorders we're talking about today, social phobia and agoraphobia. And sometimes you need to go to someone who can ask the right questions to help you, figure out, you know, what it is you're actually struggling with, and to help you overcome that, so you can get back to living the life that you want to live. And getting back to that idea of asking the right questions. So let's say that you are avoiding going on a bus. Okay, well, there could be a lot of reasons for that. And the reason might tell me that there's a specific type of anxiety disorder there, or maybe some other type of disorder. So, if you say that you're avoiding the bus because you feel like there's a lot of germs or contamination on the bus, I might be thinking, okay, this might be obsessive compulsive disorder, right? If you tell me that you're avoiding the bus because you're really scared that you're going to have a panic attack or a heart attack on the bus, and you don't think you're going to be able to get off, then I might be, well, okay, maybe this is panic disorder, maybe this is agoraphobia. If you tell me that you're avoiding the bus because you're afraid that people are going to talk to you or people are going to judge you by the way you look or how you dress, then it might be more social phobia, right? So it's all about what we're thinking, So we need to understand why we're doing what we're doing. What are the thoughts that are surrounding that? What do I think is going to happen to me when I'm in this particular situation? And all that can become more clear through a conversation with a mental health professional.
Yeah, and I think social phobia is way common. The fear, like the social anxiety and the fear of being judged. I would love to look at some kind of research on whether there's been an increase in that with the increase of social media
Mhm.
in the first place. Um, but I have some friends who like they it's like they'll still engage in the social encounters, but it's just like it's clearly uncomfortable for them. And I'm just like, man, you got social anxiety. I mean,
Right.
I don't know. Like how
Mhm.
I just, like I don't diagnose my friends because I have no interest in that. Like, but it's just like it's so common when you talk to individuals about like their fear, and the fear is of being judged, of like being judged by what you say, by what you don't say, by your reaction, by the tone of your voice, if you by your accent, by what you're wearing. Like this is it's like intense, and I think I would love to see if there's been any research on whether it has increased over the years as a result of the increase in social media and the fact that like people are getting judged so much. Because with me working with teens and children, there's a lot of social anxiety, but I don't think it really ever goes away for some people because they don't address it. They kind of just like do like get a job or a lifestyle or something where they don't have to engage with people. And then when they do, it's like the worst thing in the world, but it's not permanent, so they don't have to. So they never really get treatment. Some people just choose a permanent way to avoid it. Like, oh, well, I don't ever, I'm afraid I have like these. I've noticed that I was uncomfortable in these social situations. So my coping skill was to not put myself in those situations and not choose a job where I have to.
Yeah,
That
absolutely.
doesn't make it go away. That's just you coping a different way, but it kind of just takes away opportunities too.
It does, and I've worked with individuals before where what they really wanted, what they valued, was a career that maybe involved a lot of public speaking, like being an attorney or being a professor. And then they ended up choosing a career, where they didn't have to do any of that because of the anxiety. They ended up, becoming someone who is, sitting in an office cubicle somewhere, kind of pushing papers. When that's not what they really wanted to be. That wasn't the life they wanted. And that's how powerful anxiety can be if we let it. If we don't address it, it can really take us off our course. And all of a sudden, we're living this life that really wasn't the one we were wanting to have.
Yes, and that contributes to other disorders. Like that contributes to you feeling a different way and feeling negatively. Because to me, if I, always wanted to do something and I never did it, and then I don't know how old you turn when you realize you don't enjoy it. You're talking to your therapist, and then you realize like, oh, this is because I wanted to do this. I didn't feel like I could do this because I had this anxiety. I never addressed this anxiety, and now as a result, I am miserable.
Right.
And I feel like I feel awful. It's kind of like you have to, and if you never, checked in with yourself or tried to see more clinicians, I think mental health is more of less of a taboo lately, which is great. But
Right.
it really impacts you because you can have permanent avoidance with certain situations. There are a lot of like, especially with technology, there are a lot of jobs that allow you to not have to engage with people. But are you not engaging? But why are you choosing not to? Is it
Right.
because some people suck? Yeah, some people suck, but there's like billions on the earth, so you haven't met them all. Or is it
Right.
because you are deathly afraid of it and it impacts you so badly that you can't even breathe? That's something that you can kind of work on. So I think so many people find a way to kind of maneuver it and manage it because there are so many ways, but that doesn't mean you should.
No.
Instead of just addressing it,
No.
it's probably better just to address it.
And that was a good point you brought up around taboo, and stigma, and that's changing a bit, and people are feeling more comfortable about seeking mental health and talking to a therapist. Some communities more than others, and what I've heard a lot is hey, going to a therapist is weak. Going to a therapist is you should just man up and take care of that yourself. But actually, I think the bravest and the strongest thing you could do is confront your fears. If you confront something that is challenging for you, that's the path of strength. Not running from it, not avoiding it. And going to therapy is a way to confront, a way to overcome that, so you're not living that life that you didn't want to live it, and then showing up maybe 10, 20, 30 years down the line because you're just not happy with the way life turned out for you. But it didn't need to turn out that way. You could have made a
Yeah,
different choice.
there's no greater way to change the trajectory of your life than going than to like addressing a problem and going to therapy because you will, have someone who's challenging you and it's just like, oh, well, you're just like, well, I guess there's nothing else I could do. I'm like, oh, is there nothing else you can do? I don't think that's accurate.
Right.
I think there are other things you can do. Let's brainstorm and figure out what it is.
Right.
There may not be stuff you want to do, but these are different. these are two different statements. Like
Yeah.
not being able to do something and choosing not to do something, those are in no way the same. Those are like antithetical statements. So which one is it?
Right. And that's the question.
Like,
That's a question that only a good therapist is going to ask you sometimes. Now maybe you might,
yeah.
your family might push you like that, but not everybody has that, and not everybody has a situation where you can have that someone to push you in a confidential environment, where that person has unconditional positive regard for you, and wants you to succeed. But therapy offers that. Plus the science that I was talking about earlier, that the methods that we use are based in research, are based in the best clinical science. And I think that's important. There is a big difference between I can't do something and I don't want to, or I choose not to do something.
Yeah, and I think some people honestly just don't know to challenge it, because a lot of disorders, like we also always look at the genetic aspect. So if everyone in your family is like this, why would they think there's anything wrong with it? We're like, oh yeah, you're right. I don't think there is anything you can do. Just
Right.
leave it.
Yeah.
Like just leave
Mhm.
the situation.
Yeah. And the funny thing about that is, some of the families that, well, I don't work with families, I work with individuals, but when I talk to individuals, I do a family history and find out, about mental health and their past. And, a lot of times there won't be sort of diagnosed history of mental health problems in the family. Um, but there's always a history in the family of mental health, and oftentimes a stigma in the family, where people in the family would be like, going to a therapist or mental health, that's not real. That's not a real problem. But yet it is real, right? Because it's having this huge effect, generationally on the individual
Hmm.
and the family, which I just find fascinating that, you have a family that suffers from mental illness and yet doesn't believe it's there.
Yeah, and that's a good transition to the next place I was going, because I think that's like a cultural thing. Like you can think of racial ethnic culture. You can also think of like being from like northern, southern, Midwest culture. You can think of like a family culture. But specifically, I always, I focus a lot on African Americans because I am an African American. How do you feel culture impacts like mental health and what you've seen so far? Like, what has been your experience? I feel like there's been a big shift where it's not as taboo and things like that. How do you feel culture within like the Black communities period with mental health has changed, or how do you think it impacts even these kind of disorders specifically?
Yeah, I mean we could talk about that for days.
That's like a 50, that's like a 5, 7, 8 part episode.
That's a series. That's like Game of Thrones right there. We could be here for seasons on that. But I'll try to kind of give sort of an overview of what my thoughts are on it. I think that culture is huge when it comes to mental health, um, and it impacts mental health and seeking mental health and treatment in a variety of different ways. The first way is, different cultures, as you just kind of highlighted, be it geographical culture, be it racial culture, be it gender. Different cultures have, in general, and there's of course variation within the culture, um, differences on willingness to approach treatment or mental health professional, differences on sort of stigma around mental health or illness, and also differences in terms of presentation. You might find that certain groups will tend to, for instance, with depression, there might be more the classic sadness with some individuals, and it might manifest more as anger or irritability with men or African Americans. So you might find differences just in the way a particular mental health condition presents itself. So that's sort of one category, just differences in how mental health conditions present themselves. The second I would talk about is, I'm going to use the word bias. Now, sometimes people think bias is a dirty word. I don't think it's a dirty word. In fact, we all have biases. It's kind of built into the human brain, that we look at things with a biased lens. And culture, in a way, is it's sort of a shared bias. If we have a shared background, we also sometimes have shared experiences. Now, once again, it's not everybody has the exact same experience. Within the Black community, there's a variety of different experiences. Within the community of women, There's a variety of different experiences. But there are certain general experiences that we'll have just by virtue of being part of that community. And the way that we look at things, the way that we look at events, before we were talking about situations and how we interpret them. Well, the way we interpret situations and events sometimes has a lot to do with our culture. And that's a big aspect of the work I'm going to be doing with an individual in therapy. If somebody is having, if I'm working with a surgeon, or I'm working with a professional, let's say, who happens to be African American, they might have some thoughts about, what their white colleagues might be thinking about them when they come into a room or present a case, right? Or when they're the only one in the business meeting, let's say. And some of those thoughts, if I heard it from somebody who was from more of a privileged cultural group, I might think, hey, that's a little bit irrational. But coming from somebody from our community, it might not be so irrational, right? So we want to think about, how culture impacts the way we look at things or our biases that we have, the lens that we put on the experiences that we have and perspective there. And then the last, and this one I think is really important, and this pertains much more to the actual relationship between the therapist and the patient. We have to think about how the patient views us as a therapist. I had a supervisor back when I was in my internship who said, you always have to pay attention to what your stimulus value is. And what she meant by that was, what are your patients seeing when they look at you? Okay. When they see, a black male therapist who looks the way I look, talks the way I talk, what thoughts do they have? What do they feel like they can share with me? What are the things they feel like they can't share with me, right? So we have to pay attention to that dynamic in the room. And we have to realize that we're not a blank slate. We're coming in just by the way we look, just by the way we talk, just by the way we dress. There's going to be perceptions about that. And those perceptions might color the way people cooperate with us and how much they're willing to share and how comfortable they feel. And we have to be aware of that if we're going to be good therapists.
Yeah, that's actually a really good point, because you do bring different aspects of yourself in the room. I always say, like, I get like a good buy-in from my patients in Hopkins. Like when I walk, well, it could go either way. So when they see that I'm the clinician, like I'll either get a yes, okay, all right, or I guess it's just like, oh, I didn't expect to have a black woman as a clinician. I've had patients like this one little girl. I will never forget her. She was so excited because I had braids in she had braids, so our hair looked the same. And her mom was like, I have never had her have that reaction to someone in my life, let alone
Right.
coming to therapy. Like, so that's the thing we kind of bring in. Like, it can be a good thing. We can honestly get more buy-in from a person just because of that. It could be a bad thing, because I've also had people be like, so is your supervisor coming? And I'm like, oh my God, I cannot until I graduate, because there will be no supervisor and you will still have to see me. So it can be a good thing or a bad thing. I think those are like all really, really good points. Like, as we wrap up, one, this was awesome. I think we're actually going to have to do this again about another topic, but about just like maybe even just like the unicorn status and like how that impacts you working every single day. But one question I always end on before I like get all this information about like where they can find you. Are you accepting clients currently?
Right now, I don't have any openings, but I may have some openings in late May, early June. Actually, I'll probably
so we're still
one or two. Yeah.
Okay, so we're still gonna put all your information out there just in case. And there's nothing wrong with the wait list. But one of the things I ask is, what do you have, like a mantra, or affirmation, or any kind of philosophy that kind of helps you through life every single day? Like what, I always do affirmations, but anything that you kind of think like if something is going wrong, you're just like, well, you know what, this is just what it is. Like some people, their statement is, it is what it is. I can't stand that one. But anything that kind of motivates,
actually.
That drives me insane. What does that mean? What do you mean it is what it is? Is it negative? Is it positive? How does that teach me? It's just the worst. It's really just, it drives me insane. My teenage patients say it all the time, and I'm just like, listen, you will stop. You you cannot keep saying this. I don't know what that means. So what about you? Do you have anything that kind of helps you throughout life during tough times, or any kind of thoughts that you kind of keep around to push you through?
Well, I was going to say it is what it is, but
Oh my God.
took it from me. Now I can't use it. I was going to drop some knowledge on this podcast.
You'll never use that one again.
No, never. What I say is this, and it's not so much an affirmation, or really even a mantra. It's just kind of my understanding of the world, and I always say check your bias, because we all have a bias, as I was saying a moment ago, and that bias is going to color the way we see events in our lives. It's going to color the way we see other people. It's going to affect the way we view situations in our lives. And if we come in with a bias, and sometimes it might be a negativity bias. Let's say we had a rough stretch of time and we're just feeling down. We're going to be more likely to kind of look at things in a negative way. That bias is going to it's going to make me feel more negative because it's going to self-reinforce itself. And it's going to perpetuate me feeling down. So I want to be able to challenge that quick bias and think about some other ways I might think about my situation or the events in my life, which requires another type of thinking, which is more of a slow, reasoned thinking, which we can all use to check our biases. So that's kind of what I always say. Check your bias.
Yeah, and I would definitely say that's definitely necessary as a good, successful clinician, because when you're working with patients, it's also good to acknowledge your bias before you got to acknowledge it before you check it, right? To know that something may trigger you.
Right.
Because you can't really, just like you said, we're born with bias. You can't act like you don't have it. That's just what it is. But just by acknowledging the chips on your shoulder, you're that more mindful of them. So you know what might trigger it. And as a result, you can prepare not to be triggered by it. So if you don't know your bias, you can't even check it in the first place. And I can only imagine that's so necessary when walking through life. And all our training in psychology, there's so much self-searching in all my coursework and stuff like that. So you got to know what you bring into the room and what energy you're bringing in there and stuff like that. And it's so necessary to be a good clinician. And I always say good or great because, being adequate, you may not have to do that as much, but that's not the goal. Oh. If that was the goal, we could have figured out another way to do this. We could have just offered advice on the street and didn't go to school. It's just to be good at something, you do have to check your bias. You have to know it and check it because it is going to come out. And if you don't even take the time to acknowledge it, you're going to be sitting there snapping and you're just I didn't know I've always had a problem with this type of person. Right. You would have if you had taken the time to be mindful of what's happening in the room. So I think that's a really, really good one. I think honestly, if more people check their bias, then we probably wouldn't have so many, issues that we're having right now. That's another show.
That's another show right there. Because
that's another show right there. Mm-hmm. Yeah, I think people aren't good at that, and I think the biggest issue is individuals don't want to acknowledge that it's a part of you. It just is.
Yeah,
it just is.
Yeah, it just is, and it's just like any other part of being a human, it's just there. It's not good or bad. It's just there, and we need to acknowledge it.
Exactly. Also, do you have a favorite book?
Oh, I can go in a lot of directions with this one. I could stay on the bias train, but I think I'm going to get off of it.
No, don't do the bias train. Do something random.
Okay. There's a really good book that I just read. It's called Sapiens. It was on Barack Obama's reading list. And this is getting back to the nerdiness aspect of myself, but it's sort of it's a book that talks about the history of humanity from the early beginnings of our species till today. And the main thesis of the book is really this idea that what makes us humans is our power of thinking, our power to create collective myths, collective beliefs that we have. And, a lot of people think of, collective myths as maybe like religion. But a lot of things are collective myths, like money, for instance. We all believe in it. And by virtue of believing in that thing, we have things like a market and an economy, civilization, right? And what the book basically argues, which I think is really interesting, is that without these collective beliefs that we all share, there would be no humanity. There would be no civilization. Really great book. There's a lot of other things in there. So I just recommend checking that out.
Okay, so it says Sapiens. It says A Brief History of Humankind. Cannot pronounce the name. Yuval Noah Harari. But I'm gonna put it in the show notes because I hate mispronouncing stuff. Also, tell everyone where to find you, like website, just in case you do get some openings in May. Yeah.
Sure. So you can check out my website, which is going to have all my contact information on it. That's www.psychforward.com. That's psychforward.com. You could also just Google me, and you can find my contact information that way too.
Google me.
Google me. Scatino, I'm probably the only one. That's S as in Sam, C as in Charlie, H as in Harry, E as in Edward, T as in Tom, T as in Tom, I, N as in Nancy, O. First name Jonathan. You can look me up. I practice in Baltimore. I am right on Charles Street where the Washington Monument is. Yes, we have one of those in our city too.
I actually legit did not know that, and I work at Hopkins.
We do.
That's awful. That's so bad.
You'd be surprised. I talk to patients who have been living in Baltimore their whole lives, and sometimes they don't know there's a Washington Monument.
I was like, Washington Monument, Baltimore. Oh, great,
Yeah.
He's been drinking. Like now, okay. Like,
yeah. I mean, it is Friday afternoon, but
it is Friday afternoon.
So I practice in Baltimore. You can find my contact information, like I said, either by going to the website or doing a Google search for me and seeing what comes up. That's how confident I am about my Google search. That
yes,
you can just Google
I mean, you do. I mean, I'm a big trying to find clinicians everywhere, and that's how I found you. So
yeah, there you go.
I will be like when I can track anyone down. I'm like Inspector Gadget over here. Like it's almost like I'm getting a degree in research. Like,
right. Almost like that, Right.
Everyone's always like, how do you find people? You can find people anywhere, okay? You need to use different search codes, okay? You need to use different resources. Just make it happen. You need to find a resource. There's a resource for everything. If research has taught me anything, it may not be the most cited. It may not be the most used.
There we go.
But it's there. You just gotta find it.
You need to do a show on that next.
Right? Like it's like that's my mantra. It may not be the most cited, but it's there. People have done research on everything. You may be like, why did they? They got funded, they made it happen. Yes, it works. So thank you again so much for being on the show. I greatly appreciate it. I hope everyone has learned so much about social anxiety, agoraphobia, all that stuff. And you feel more educated at the end of this episode. Thanks for tuning in, guys. You can find me anywhere you can find a podcast, iTunes, Spotify, Overcast, Acast, Podbean, Blueberry, we're everywhere. Also on Instagram, Mind Your Mental Podcast, and Facebook, Mind Your Mental Podcast. So thank you so much.